Welcome to the Heart Rate Variability Podcast, where we explore the exciting science behind heart rate variability. The material discussed in this podcast should not be taken as medical advice. Please check with your medical provider to make sure any suggestions or strategies are right for you. Visit us at the OptimalHRV.com website to learn more about the Optimal HRV app, download a free copy of Matt's book, Heart Rate Variability, and also get show notes and additional resources around heart rate variability and its applications.
Hello, everybody, and welcome to another episode of the Heart Rate Variability Podcast. Jeff Summers here with a proud new member of the Optimal HRV family. You guys all were introduced to Dr. Dave last week. It's my first opportunity to talk to Dave on the podcast. Welcome, Dr. Dave. We're so excited to have you as part of the Optimal family.
Well, thank you, Jeff, and very happy to be here and an official part of the family.
That's it. So we're super excited. You bring a totally different background than what we've currently had on the team so far. And today we kind of want to leverage that and kind of educate some of our listeners from a clinical perspective in terms of how you as a chiropractor are using HRV in your practice. So as you all know, we've got a lot of people reaching out from a clinical perspective saying, we listen to your podcast, we've read Matt's book. This sounds great, but how do I actually use HRV in my practice? What does my day-to-day look like? How do I communicate with my patients? What results should I expect as a result of using this with my patients? All those kinds of questions, which we love to get, and we certainly understand. This is something that's new. It's not been part of curriculum in the past, those kinds of things. So really wanted to spend some time with you, Dave, to take our listeners through a day in the life of you as a very, very busy chiropractor. How are you using this with your patients? How are you finding time to analyze results? How are you communicating it? How are your patients leveraging it to be better, be healthier, all those kinds of things? Millions of questions, and I know you're prepped to talk about all of them. But as you can tell, I'm excited for the session today because I think this is one of the first real world opportunities to communicate how HRV can be used on a day-to-day basis. So I'll shut up and I'll let you kind of get into it because nobody wants to hear me talk about it. Everyone wants to hear you talk about it.
well, all right, Jeff, and we will dive into that. And for listeners, of course, I'm taking this from a chiropractic perspective. And a lot of this can be applied directly to other forms of healthcare as well.
Oh, and sorry, Dave, one quick thing I forgot to mention before I turn it over. So we're going to be talking about a lot of things that are going to show up in our October release. So we're recording this the last week of August 2021. We've got a big release coming in October with a lot of new functionality. You're going to be talking about some things that are going to be incorporated in that release. So for folks who are using the current version of the app, you might hear Dr. Dave talk about some things and wonder, wait a second, I don't see that right now. What is he talking about? But you will come the first week of October. So I just want to get that disclaimer out of the way for folks who are currently using the app, so there's no confusion. Everything you're going to talk about will be widely available starting the first week of October. So.
Yes, we are in the future right now. Right.
Exactly. There you go. Where's Doc Brown?
Yes. So as we get into this, one of the first things is, why would we be using technology in the office? That's one of the first big questions. And for the most part, chiropractors in general and most healthcare practitioners are going to be using some type of objective data to find what's going on with your patient. Now you can do that from a physical sense, right? Like doing some kind of muscle testing, doing palpation, that kind of stuff. But when we get into using technology, well, now we have a very, very objective finding, and And this is something that we can really track our progress with. And that's one of the first reasons why I say, we should all be using some sort of technology in our office. Now, there is a couple of large names within chiropractic right now that do provide technology within office, and those things are awesome. I'm a large fan of that. And I'm sorry, I'm going to click this off so that I don't get another you have an email ding.
So dog will be barking any minute. You probably hear my kids out the door, so no worries.
Yes. So in getting that technology into the office, what that does is it starts to change the conversation that you're having with the patient. Rather than when a patient comes into your office, and unfortunately within chiropractic, what we see a lot is somebody comes in and they're complaining of some kind of discomfort, some kind of pain. And as most chiropractors listening to this will know, okay, that's not our primary focus. That's not what we want to be working on. Although pain is absolutely something that we help with, we are always interested in the underlying cause. Why are you having this pain? Why are you having this discomfort? And that's often going to go several layers deep. So when we introduce some type of technology, it helps us take away that conversation from the symptom, which is something like pain, and talking about the actual issue. And then when we do, quote unquote, fix the pain, although we aren't fixing anything, right? Your powerful body is doing all of that healing on its own. We're just allowing it to happen. When we do get that pain to subside, we are also working on the underlying issue. And then with this objective data, we can actually see the progression of that underlying issue. Is that making sense to you, Jeff?
Absolutely. Yeah.
Okay.
I think the whole idea of objectivity, consistency, those kinds of things are brought by technology. And I think everybody is searching for that. And of course, when we go see practitioners, it's great to treat, the immediate symptoms, but ultimately, if we don't get to the problem, it's not a long-term fix. So, being able to leverage technology to be able to do that more quickly, I think benefits everybody.
Yes, absolutely. And to give a quick example, this is something that a lot of us have seen who are in current practice. Somebody comes in with what they would say upper shoulder, trap or neck pain. And they come in and say, I want this pain to go away. Maybe they've tried some other things. Maybe they've tried physical therapy. Maybe they've maybe they've even gotten an injection, cortisone injection, something of that nature. And the problem persists. Okay, well, everything looks normal on X-ray. Everything looks normal on an MRI. So what's the problem? The problem is how the nerves are communicating with each other. And that is what we were after. That's what we have to fix. Now, when we look at something like what's going on with maybe your neck, maybe your trapezius muscle. Okay, so a lot of times this is related with stress, right? Which is going to bring on a larger question, right? It could be posture related, right? Which is another form of stressor. But how do we measure these things? And, that's where heart rate variability, where HRV is really going to take off to help us measure and quantify things like that. Then as we see the pain go away, we can see that HRV creep up. As we see continual improvement, we can see that HRV creep up, and things like that. So it's a very quick example, but a very cool and relevant example. So
yeah, that makes sense. And I think that's a theme throughout the podcast that I'm sure a lot of listeners have picked up on is, stressors come in all shapes and sizes and forms. And, it's not just work stress, stress is everything. And nerves not communicating properly or posture, to the example you gave, is another form of stressor. So I think keeping that frame of mind is interesting for somebody like me who's on the patient side. It's like, okay, well, even bad posture is a form of stress, right? And so when you think about what our HRV measures, this is really interesting to see how it can correlate to that as well.
Well, and that's another thing that that is really big to understand, and something that we explain to all of our patients is Dr. Bruce Lipton said it best in talking about cellular physiology, but it's the 3 T's that bring on stress to our bodies. So and he labels them as traumas, toxins, and thoughts. and when you look at that, it's okay. So traumas, which would be which would be something like an actual car accident, or posture is a very, very slow trauma setting in, and then toxins, of course, would be stuff that you're consuming, things within your environment that are causing stressors on the body. And then your thoughts, of course, you're, moving into where Matt and Miss Eno would be working a little bit more. So,
That's right.
But regardless, we're all familiar with these, and that's why also I don't like to refer to things as stressors, because people get into that. Oh, I'm so stressed. Thought of mind. It's I like to call them life metrics.
There you go. That's good. I like that. I've not heard that before.
Yeah, that's what I refer to it with my patients as, because it makes a lot more sense then. Okay, this is something that I'm stacking and piling on myself, right? So then when we remove those things from the pile, we can see results.
That's great.
All right. So then additionally, before we get into the how I use it in office, for all forms of healthcare, what we're interested in affecting is our autonomic nervous system, and when we talk about ways to measure your autonomic nervous system, there is no better way than heart rate variability. So we want to measure function of your autonomic nervous system. We take a heart rate variability test, right? And then we can see exactly where you're at. We can see how treatments affect you, and so on and so forth. So a quick little aside right there.
Yep.
So how do I actually use HRV within practice? And that's probably the $1 million question. Well, how do you get patients to do this?
Exactly.
And there is two different ways. So I've been using HRV for a number of years in practice, and what I have found, as I'm sure all of you listening have found, is that some patients are extremely interested in learning everything that they can, and they want to be your partner in getting them to their best. They want to really be active in their healthcare. And then there's other patients who are just like, you just do everything. You take care of it for me.
That's what I'm paying you for. Exactly.
Yeah. And we love both types of patients. But of course there's one of the two that tend to get better quicker. I wonder why.
Imagine that, right?
So when we look at this, how are we using it in there? So every single patient who comes in every single day, it's not even an option. You come into the office, you take your HRV before your adjustment. So before the time that you're going to be seeing me, and then you take it right after. That's just part of the flow within the office. So that is one way, and every single person does that. Whether you're interested in being part of my whether you're interested in being active in your healthcare or not, you are doing that every single time you enter my office. It takes 3 minutes. You sit down in a cozy chair in the waiting room. You put on the finger reader device, open up the app, and you take your HRV right there. Then you come in, you see me, I work with you, and then you go back out and you take your HRV reading again. So another 3 minutes. And then after that, you can see pretty quickly the change that happened pre and post. So you can see the immediate effects of that session. So I will tell you, for chiropractors listening who are thinking one of two things. Well, that's awesome. We can right away show how beneficial a chiropractic adjustment is, and absolutely, for the most part, we see huge improvements pre and post. Now, the other thing is, and that of course is because we're stimulating parasympathetic nervous system, right, or vagal activity, which is what HRV is looking at, right? A lot of that is measuring vagal tone. And then as well, there is the occasion where you actually see somebody's HRV go down after a visit. And that is one of the things that scares most doctors the most, and why they don't use some sort of technology, is that fear of, well, I took the measurement and then I did my therapy. I went through their care plan. And now if I take another measurement, it might not say what I want it to.
Right. You don't have that control. You never know, right?
Right. And it, and okay, I can see where that is scary, but that's a lack of understanding. That's all it is. Because if somebody comes in with an abnormally high HRV and you do your therapy on them, and then after they leave, their HRV went down, well, maybe that brought them closer to their baseline, and maybe they were very dysregulated coming in, and what that therapy did was actually regulate their nervous system. And that is something that we see as well. So no fear within that, right? Scores can change for the better or the worse. For the most part, it is for the better, but there's always a good reason why that might happen, where a HRV may actually lower.
That's it. Well, and you bring up a couple really interesting points, right? Number one, the importance of establishing baseline.
Yes.
If you don't know the baseline, then that drop becomes more scary. But if you do understand the baseline and you know what sort of average is, that's really important. And just the fact that you've got that level of communication with your patient that you never had before, and that objective measure of what did this session do for you is something that historically practitioners have never had the ability to leverage. And so, I think those two things are really cool.
Yeah, and that's intrasession, is
Great.
so huge, because yes, it's every 4 weeks, every 6 weeks, we do a progress exam, and we can see the changes that happen. Well, now we're seeing every single time, right? And that's giving us even more data, and of course, the more data that you have, the more dialed in you can be with your therapy and your care programs. Now the second way that I use HRV within the office is actually not in the office at all. So I will, and this is at the moment, I hand select patients who I will send home with HRV devices, and the patients, of course, purchase it as part of the program, and they will go home with an HRV device. And these patients will take their HRV every single morning, just as we would recommend for anybody else. Now, of course, this is going to be more those patients who want to be an active part within their healthcare, right? Because there's a lot of patients out there who you tell them, I want you to take this every single morning. First thing when you wake up, take your HRV. A lot of them are going to say, nah.
Right. Or they'll say, yeah, but then, they won't really actually do it,
Right. And you learn very quickly. So when you find the patients that are willing to do that, when you have patients coming in that want to be part of their healthcare, you explain to them the importance of this, of doing it in home, and they begin to do that. And actually, it's gotten to the point for me where it's, well, okay, now it went from being like, okay, I'm kind of comfortable with this, and now you get to the point and you're like, all right, well, this is something that every single patient should be doing, whether they want to or not.
Exactly. And talk about the value for you, for the folks that are doing it on a day-to-day basis, or at least 3, 4, 5 times a week. How much better care can you give it? I'm sure you're going here anyway. I'm probably interrupting your flow a bit, but how much more valuable is your communication with those types of patients versus the types of patients that just aren't going to do that?
So yes, and exactly where I'm going, but I'm glad that you asked it.
Glad I didn't totally take you out of your flow here.
No, you're great. So for the patients who are using it every day at home, we are getting a true baseline, because when we see them in our office in the middle of the day, whether that be, they're some of our first patients of the day, or whether it's, the very end of the day patients, if their time is consistent, that they're coming into the office, yeah, their HRV should be fairly consistent in theory, but let's face it, each day is drastically different than the next. If you came in and you almost got into a car accident, 5 minutes before you came into the office, your HRV is going to look horrendous in comparison to, it'll be a very obvious outlier.
Yeah, there you go. Exactly.
And those types of things. So when you're in the midst of a day, things that happen throughout that day are going to significantly weigh on your body in one way or another, right? So these could be very positive things that happen to you throughout the day. They could be very negative things that happen throughout the day, or it could just be a regular day, but by the end of the day, you're depleted. That's why we feel tired and you want to go to sleep at the end of the day, right?
Yeah, exactly. You need recovery.
Yes, and that is our autonomic nervous system literally just wearing down, right? That's our so when we look at metrics like when we talk about things like total power, and our and various other functions, that's where, okay, yeah, we might see these things wear throughout a day, and that's what we would expect. But when we get it first thing in the morning, that is going to be the most consistent time of everybody's day. You just slept all night, unless you have little kids.
Unlike you and I, who some nights we do, some nights we don't, but that's okay.
Right. Yes.
We chose it. We can't complain.
But that's still true to us, right? When we take our HRV.
That's true. Good point.
It's funny. I actually have some patients who are so into it, and they're like, I didn't take my HRV this morning because I knew it would be bad. I'm like, you have to still take it on those mornings.
You got to know exactly.
But yeah, so that first thing in the morning when you first wake up, your HRV is going to be the most consistent and the most true for where your baseline is at. So when we start to see that, then we can really see the things, how day-to-day things are affecting you, how a treatment plan, if this is what we are integrating is this new care plan within whatever type of healthcare, we can see how that is affecting your body. Is this having a positive effect day to day, week to week, month to month, or is this having a negative effect? And of course, there's multiple things going on in people's lives, right? It's never just that they started up a chiropractic care plan or a physical therapy plan, right?
Sure.
But we can factor all of those things in, and that is going to be the next huge thing here is when we can start to get patients doing this on a regular basis, and we can see their baseline scores. Then we can talk about those ups and downs. We can see what is happening within their life each day. And this opens up such big conversations with our patients and provides the opportunity for us to really connect at a much deeper level with our patients. Because again, it takes us away from that surface level, this is why I'm here, we're fixing this issue, and down to, okay, well, these are some of the other things that are going on in my life. And then that opens the door to, okay, how can I help my patients with this? And of course, I'm not a magic man, and I imagine that most people listening are not magical healing doctors of every profession either.
I bet some of your patients might disagree, but that's okay.
Yes, but it opens that door to say, okay, you know what, this is a great time for me to refer you to this functional medicine doctor that I work with, because we need to talk about things that are going on with your diet and how that's causing inflammation within your body, and how we can start to chip away at that, right? Because that is a bigger piece of this whole puzzle that we are missing, or we realize like, oh my gosh, this patient neglected to tell me that they've been having these sleep issues for years and years. And sure. It came up because we were saying, well, what could the cause be of your HRV starting to trend down here? Oh, work has been stressful. And then whenever that happens, I stop sleeping, and then, and blah, blah, blah. And we get into the whole spiral of things. And then another opportunity for us to help our patients at a deeper level. And that's just awesome when you can help somebody from, as I like to say, that whole life perspective, or that whole human perspective, when we're not just focusing on this problem, we are focusing on their entire life and everything that affects them.
We're back to what you talked about earlier. We're not just focused on this symptom, which might be back pain or neck pain or whatever, and they come to you to alleviate that for what turns out to be a short period of time, because that's not, that's the symptom, not the problem. And they don't think when you go into a chiropractor, for example, I don't think to share that I'm not sleeping well.
Right.
Often,
right.
Like that's not quote unquote part of what a chiropractor's there to help with, and the way we certainly as patients think about things, it's like, okay, I'm at this specific caregiver who is here to provide care for X, Y, or Z, you know, whatever it might be, back pain, neck pain, you know, a massage, whatever it is, acupuncture, but you don't think to say, okay, I am having a stressful time at work, or my kid's not sleeping, and you know, those kinds of things are going to affect all of it. And without having this way to reframe it and look at your just core system and how it's functioning, that stuff's never going to come up with you. But you know, you've got strategies, you've got ideas in terms of how to provide care for all of these things that, you know, people may not think of as going to a chiropractor for. And I don't mean that in a bad way at all. It's just sort of how we segment practitioners and what they're supposed to quote unquote do for us. But you know, I mean, you've studied all of this in such incredible detail, and you understand the inner workings of where the ANS sits and what it affects. And so awesome. You know, I mean, what a cool opportunity, and I'm sure your patients really appreciate it, because again, now you're treating the problem and they're feeling better for a longer period of time as a result of that. You're not just giving them an adjustment and sending them on their way.
Right. And exactly, Jeff, I hit the nail on the head. And what and another great thing that we see as a result of this bigger conversation too, as you brought up, you know, maybe there is something going on with their child or something that's keeping them up. Well, that might be something that we say, oh, well, you know, your 4-year-old or your 7-year-old is still wetting the bed, and that's something that you're waking up every night for to help out. Well, did you know that this is something that we actually help with as well?
Good point.
And that's another way to as well. Yes. Okay. That opens the door again to that bigger conversation where you can share what else you are able to do, you know, or give the referral for the appropriate healthcare provider.
Right.
To better help out that patient. But absolutely. And that's, you know, to that point, I had a really cool thing happen before where a patient, you know, it came up that, oh, well, you know, when my husband sleeps in the same room as me, he snores really loud, and, you know, and then I don't sleep. And it came into the whole, wait, so you and your husband don't sleep in the same room? She's like, yeah, you know, blah, blah, blah. And when we started getting into it, okay, well, if your husband's snoring that loud, there's probably something going on. He should see a sleep doctor. Sees a sleep doctor, gets a CPAP machine, and now they're sleeping in the same room again. Granted, you know, she has the sound machine noise of the CPAP, but you know, hey, we really helped out.
Noise.
Right?
Exactly. That's real stuff. I mean, that has long-term effects on relationships and, you know, the health of an individual's nervous system as well. So, you know, it's kind of funny, but it's also really impactful.
Yeah. 100%. Okay. So another big thing that a lot of docs may be wondering about how this actually functions. Well, how do I see the data? Okay, so these patients take this thing home and they're reading it, or the patients are in my waiting room and they're taking their reading. How do I get it? And that is the coolest thing. And honestly, what made me love you guys from, you know, our very first conversations when I first met you guys is and I'm talking for those of you listening, I'm talking to the Optimal HRV crew as a whole. That's and right. I love you too, Jeff.
Yeah, I love you too, man. But it's us now, right? It's not us guys. It's all of us. So
yes. Is that they have this WebDash thing, and this has been a part of something that I've been very big on helping them with developing, is this WebDash for practitioners to use. And it is so cool because the second somebody does a reading on their app on their phone, regardless of where they're at, it is on my computer. It is the coolest thing. So patients are so amazed that they're sitting there in my waiting room, and when they come in to see me, oh, okay, you're at a 54 today, you know, and they go, how did you know that so quick? And it's very cool. You know, as well, I you know, some doctors may not choose to get as involved as I do with patients, and that is totally fine. But for example, you know, we can set alerts within there so that I can know when a patient is having a down streak within their HRV as well. So I can get an alert that will notify me to say, For example, Jeff's HRV has been trending down for 2 days in a row. Maybe let's reach out to Jeff and see what's going on. And that gives me the opportunity to say, hey, Jeff, I know I'm not going to see you until next week, but I've noticed this downward trend in your HRV. What can I do to help? How can I be of assistance to you? And patients absolutely love that. When you can help at that higher level, when they're not actually seeing you or in the office. And then when we so getting further with the WebDash, you can analyze data in many different ways as well, which is something that I will talk further and further about throughout other podcasts and as well within a training program that we are going to be releasing here. But how does this transfer to the patients? Aside from how we talked. So what's the big deal if my patient's HRV is trending down? Why would I want to reach out to them? And that is one of the coolest things with tracking somebody's HRV on a consistent basis, is that is an early detection, an early warning sign of stuff going wrong, right? And that is what we want to hammer home here, is that if somebody's HRV is trending down, we see that as an early warning sign to illness, right? When your HRV is trending down, that means your autonomic nervous system, your immune system, as well, is depressed. That means that all of these bugs, all of these things, right, that are on us or in us, or all of that that are just waiting, they have the opportunity now, because our system is down-regulated. They have the opportunity to take us over, right? And that is when you are going to get sick. Equally, you're more likely to get injured. Why is that? Well, because when your HRV goes down, your reaction time goes down. And you're more likely to make these mistakes. You're more likely to do things, whether it be in the gym, whether it just be stepping off a curb, where
in the middle of playing a sport, you're just not quite, your body isn't quite where your mind wants it to be, and you roll your ankle or whatever else, right?
Yes, absolutely. And then mentally, emotionally too. When your HRV is trending down, you are much more dysregulated. So you're going to see, that you might fly off the handle a little bit easier. It might be that, when your kid, accidentally breaks something, instead of saying, "Hey, Johnny, oh, I understand that you accidentally bumped that," and do the high quality parent talk through. It's "Hey, what is your problem?"
Yeah, no kidding. Why did you do that? Yeah, totally.
Yeah. So it's, as we've talked about in past podcasts at this point, and I know Matt has definitely touched on this, is, are you responding for more of that ventral vagal or the dorsal vagal response?
Exactly.
And definitely when your HRV is down, you have much less of that ventral vagal side to pull from. So then, okay, well, what good is that? So I know that my patient's HRV is trending down. So what? I know that these things are more likely to happen. Do you want me to tell them to stop living their life today?
Stay in bed. Don't leave the house.
Yeah. All of these horrible things might happen to you. Yes.
Yeah, exactly. You're going to get a car wreck on your way to work.
Yeah. So we're the fortune tellers now.
Yeah, exactly.
But no, it's how can we help them so that although they are having a down day or a down stretch of days, what can you do? And this is where we can get into the concept of, well, sometimes you can't just cancel the big meeting that you have. Sometimes you still have to parent your children. Sometimes you still have to show up to practice,
Still have to go to work, still have to live your life.
Yes. So what can you do? Well, let's quickly delete all the things off of our plate for today that don't have to get done, right? So we can pull that as a strategy. Can't delete anything, or so you think. Let's turn up the good. Maybe make some extra time for meditation today. Make some time to do a slow-paced workout of some sort that is going to fill your body. Take some extra time to, at lunch, maybe take a walk through the woods, take a walk someplace beautiful that makes you happy. Do something that is going to fulfill you and charge your nervous system rather than do more things that are going to deplete you. These are going to be
Pay attention to
simple
what you're
things.
eating. That's,
Yes, 100%. That's
because often you're dysregulated, you're tired, you want to, fast food is sort of going to give you that quick jolt or whatever, but that's not what you need. Just simple little things can help.
Yes, 100%. And that's arguably one of the biggest things is your diet, what you're eating every single day. That's going to be pulling you in either direction. But that's what we want patients to realize, and for all of you doctors listening as well, is that there is things that you can do to combat this, so that even though you still have to show up to life today, you can show up at the best that you can be today. Right. And that's what really matters.
That's right.
Then another really cool aside is that you can test new things. So this is actually something that I'll probably be talking about with one of my patients when I interview her, because she's done this too many times to count at this point. But you can test new things. So for example, a new dietary program, right? So if you change your nutritional regimen, right, in some way, is this a good change or a bad change? Well, you can watch that trend over a week and see, is my HRV consistently going up, or is it coming down? And then pair that, of course, with subjective, how are you feeling, those types of things. You can see that with your exercise plan, with your sleep. You can see that. A big thing is you can see how horrible alcohol is for you.
It is. I'll tell you what, there's no doubt.
Yes, alcohol paired with lack of sleep, biggest way to drop your HRV.
Exactly, that's right. And so often they're paired together, right? So
yes,
too much alcohol often results in lack of sleep, certainly lack of good sleep.
Yes, yeah. And then same with things like food allergies and supplements too. You can literally test these things with your HRV. So that's another very powerful way that practitioners can use this. And I'm sure with a lot of doctors listening, I have patients who are just so darn into it, that they are inventing the uses for this on a regular basis as well. Like, hey, I did this, so I tested it with my HRV, and this is what I saw.
Exactly. But I think this is a great point you bring up, because I know you're speaking most directly to chiropractors because that's the field you're in. But if you're a nutritionist, if you're an acupuncturist, if you're introducing your services to new patients, you're going to be able to see a pretty drastic change pretty quickly in their HRV scores. Communicate that quantified process, the quantified success, whatever you want to call it, in a way you didn't have before. So why wouldn't you at least introduce this with new patients to say, hey, you're trying something new, let's get your baseline, let's show you what a couple of weeks of doing what I recommend is going to do for you in your autonomic nervous system, your stress response. And subjective is great, but everybody's leery of new things and of change. And so if you can show them on a day-to-day basis, this is how it's impacting your biology, they're going to be clients for a very long time.
Yes,
for a very long time.
Yes, absolutely. Yes, and they refer their friends and family in as well.
Exactly. That's right.
Yeah, for sure, man. So that's the basis of what I wanted to of what I really wanted to cover today is how I use it, why I use it, and some examples like that. And for example, right, like I'm gonna bring patients on and interview them so that we can hear some of this firsthand as well. But it's when you see people, like I had a patient, we'll call him Troy, and his HRV was trending down, and his whole family was already sick, right? And he was starting to trend down into that, and we recognized that, and I was able to help him with some tips and advice. And you know what? He never really got sick. Now, would he have gotten sick anyway? I don't know.
Right? He didn't. So
nobody does know. But the fact that he didn't, and the rest of his family did, really speaks volumes, right? Yeah, and it's very cool when you can see things like that. And I'm going to go through, patients with all of this stuff. I'm not going to do that here because I know that we're about out of time anyway. But multiple examples of how it helps, even within pregnancy too. Monitoring that is very important, right? Because we want to maintain a healthy, beautiful pregnancy, and that's something as well that we can see. And then the after effects of pregnancy too. You can see that on HRV when somebody is consistently measuring.
Oh, that's definitely going to be another podcast episode because it's so important, and there's just so much going on in a woman's body when she's pregnant, and postpartum and everything else. Talking about how HRV can help, I think, will be really interesting to a lot of moms, prospective moms. Anybody sort of interested in that. Looking forward to that one as well.
Yeah, absolutely. And then one final thing that I do want to mention, because I know this is something that, the most difficult thing that we have is getting patients to do what we ask them. And we as a company are trying to remove that hurdle in that we're trying to bring forth, a wearable that would be amazing. That would be something that everybody could wear and you don't have to think about. Now, at the moment, we do have the technology where we can bring wearables, where we can bring your wearable that you may be using right now, like the Apple Watch, for example, and we can read directly from that. So if you're somebody who's wearing an Apple Watch, you have a patient who's wearing an Apple Watch and they might not be that into their healthcare. Well, guess what? Their Apple Watch is taking their HRV, whether they know it or not.
Right.
So they're already doing the work for us. So that's something, again, that's another way to use another tool, another access point for us. But that's about it. Did you have any other questions for me, Jeff?
No, great stuff. I mean, really appreciate it, Dr. This is fantastic, and I think hopefully answers a lot of questions from a lot of folks that listen. And yes, it sounds cool, but how do I actually do it, and how do I incorporate it? So I would encourage anybody to reach out if you have questions, if you're a practitioner and you want some advice in terms of how to onboard this in your practice. Send an email to support@Optimal HRV. We can get you connected with Dr. Dave. We can offer some of the feedback that we've gotten from some of the other clinicians that use Optimal HRV in their day-to-day practice. But we're here to help. I mean, as everybody is, I'm sure, seeing, our mission is really to help people feel better and help practitioners use technology to be able to provide better services and quantify the effects of their services to their patients. And so, reach out if you have questions, if you have interest, if you want to learn more. We're here to help. So, otherwise, thanks, Dr. Dave. Again, super excited to have you on board as part of the team, and look forward to many future podcast episodes coming up soon.
Yes, absolutely. Well, thank you, Jeff. Lots of fun, and we'll chat soon.
All right. Thanks to all the listeners as well. We'll talk to everybody soon. Take care.